Anemia is one of the most common blood disorders worldwide, yet many people don't realize they have it until it's already affecting their health. Characterized by a lack of healthy red blood cells or hemoglobin, anemia leads to fatigue, weakness, pale skin, and shortness of breath. But what really causes anemia? While iron deficiency is the most well-known cause, anemia is often the result of deeper, hidden issues that need to be understood for proper treatment. Here's a closer look at the hidden causes of anemia you need to know. 1. Chronic inflammation and autoimmune diseases. Inflammatory conditions like rheumatoid arthritis, lupus, or chronic infections can interfere with your body's ability to use iron and produce red blood cells. This is known as anemia of chronic disease. The inflammation blocks iron absorption and suppresses bone marrow function. Why it's hidden. Standard iron supplements often don't work unless the underlying inflammation is treated. 2. Vitamin deficiencies, B12 and folate. A lack of vitamin B12 or folate can cause megaloblastic anemia, where red blood cells are abnormally large and dysfunctional. This type of anemia can also cause neurological symptoms like tingling, numbness, and memory problems. What causes it? Poor diet, malabsorption, such as in celiac or Crohn's disease, or long-term use of certain medications like metformin or antacids. 3. Menstrual blood loss. In women, heavy or prolonged menstrual bleeding, menorrhagia, is a major, yet often overlooked cause of anemia. Month after month, significant blood loss can lead to iron depletion, even if dietary intake seems adequate. Clue: if you're feeling unusually tired or faint during your cycle, it might be more than just PMS. 4. Gut health and malabsorption issues. Conditions like celiac disease, H. pylori infection, IBS, or chronic diarrhea can impair the absorption of iron, B12, and folate from foods, even if you're eating a nutritious diet. Sneaky sign: you may be eating well but still be nutrient deficient due to poor absorption. 5. Kidney disease. The kidneys produce a hormone called erythropoietin, EPO, that signals the bone marrow to make red blood cells. In chronic kidney disease, EPO production drops, leading to fewer red blood cells and resulting in anemia. Often overlooked, people with mild kidney issues may not realize their fatigue is related to low red blood cell production. 6. Internal bleeding. Slow, hidden blood loss from conditions like stomach ulcers, colon polyps, hemorrhoids, or even colorectal cancer can lead to anemia over time. This blood loss may not be visible but can significantly deplete iron stores. Warning sign: unexplained fatigue or iron deficiency, especially in men or postmenopausal women, should be investigated thoroughly. Verse 7. Genetic disorders. Certain inherited conditions like thalassemia or sickle cell anemia affect how hemoglobin is produced or how red blood cells function and survive. These forms of anemia may be lifelong and require specialized care. Note: some forms are mild and can go undiagnosed for years. Anemia is not just about low iron. It can be a signal that something deeper is going on in your body. If you constantly feel tired, cold, or foggy-headed, don't ignore the symptoms. A proper diagnosis and lab work are essential to uncover the root cause and guide effective treatment. Listen to your body. Anemia is a symptom. Find the source, and you'll find the solution.